We've been at this pandemic thing a long time. Remember when there were some that were planning on it being over after just a few weeks? Well, here we are, nearly 18 months later, and more than a handful of coronavirus variants. Well, today, Governor Brad Little announced to the state, we are now at the point of a last-ditch effort when it comes to Idaho's COVID mitigation plan. This last-ditch effort is to avoid a first-time-in-Idaho catastrophe, a statewide crisis standards of care declaration. The plan is to add hundreds of new medical personnel to Idaho's hospitals. But it's not like we can just order more from Amazon or just take them out of storage. These new medical personnel will be in the form of Idaho National Guard soldiers, as well as contracted employees the state is bringing in to help hospitals who are facing a lot of challenges right now. A short time ago, state healthcare experts echoed what Governor Little said. We are teetering on the edge of the worst situation our hospitals have seen since COVID hit Idaho back in March of 2020. And some would argue, Joe, the first time ever in the state of Idaho we've ever gotten this close to crisis standards of care. So how bad is it from both the healthcare perspective and the commander-in-chief perspective?
Well, Brian, before we set the stage for our conversation, first I want to just check in real quickly on what Governor Little said this afternoon. This is how he described the current situation we're in.
We are dangerously close to activating statewide crisis standards of care, a historic step that means Idahoans in need of health care could receive a lesser standard of care or may be turned away altogether.
Okay, so that was a big statement, but shortly after that, he also said that we are pulling out all the stops with this announcement today when it comes to this pandemic. But the question we've seen a lot of, and we want to know ourselves, are we though?
Yeah, and this has been a conversation on social media in our community since Governor Little said today, again, we're pulling out all the stops to face COVID. So let's take a look at the situation we're in right now, and we're going to compare it to last fall when really we were in a very similar situation. Right. The National Guard was being called out. This was all being handled differently now compared to then. So let's take a look at November 13th, 2020. Governor Little announced then, Brian, for the first time that he was activating the National Guard to help the medical system in Idaho handle COVID. It was a new and different challenge at that point. So here's where we sat. This is November 13th, 2020. There were 1,519 new cases of COVID, 82 people confirmed with COVID in Idaho's ICUs, and the state was moved to a modified stage 2 restriction. Remember stage 2? Let's take a look. Remember, this was stage 2. This was about a year ago. Restrictions at that point: no gatherings of more than 10 people. At-risk Idahoans were asked to completely self-isolate. All Idahoans were encouraged to telework at that time, and mask use was continued to be required at long-term care facilities. And a lot of people remember this: bars, nightclubs, and restaurants, they needed to operate with seating only. So again, that was November 2020. Let's take a look at today. Here's how we compare from last year to now. The latest daily case count for COVID, 873 new cases. That is down from about a year ago. Now, the big data point here is the ICU capacity. And at the last full report from Idaho hospitals, that was on August 29th, a few days ago, we had 160 people confirmed with COVID in our ICU statewide. And that is double the amount we saw in November of 2020, again, when the healthcare system began to see major challenges, and up until this point, the biggest challenges it's seen. Right now, we're in stage 4, and as many of you may know, there's essentially no COVID restrictions if you compare stage 4 to stage 2.
Joe, before you go any further, I want to leave this up here for just a second because that's a big number. 82 confirmed COVID patients back in November of 2020, 160 now. And you can see the COVID cases also kind of the opposite, right? We've been told over and over, the COVID case number isn't the most important number, but it is when it comes, the number that is, that COVID ICU patient number.
Right, because those COVID cases may not necessarily translate to people going to the hospital, but we can say for a fact, if you have 160 COVID ICU patients statewide, you need to deal with those people, and you need to make sure you have the resources in terms of the physical space and the staff to handle that. Of course, the major headline today also, Brian, is that Governor Little called up National Guardsmen again. You can see on the graphic there the difference between the situation in November 2020 and August 2021. The situation is political now, Brian, and we know that. Masks and vaccines, a lot of the time it may not even be about the science when politicians are talking. This is the way it went. The entire situation has been politicized. Now, that thought was reflected today when Idaho Health and Welfare Director Dave Jepsen addressed scientific health recommendations in regards to the current situation. Again, people are asking, are we really pulling out all the stops?
Right.
Could the state of Idaho be doing more? Well, spoiler, according to Director Jepsen, it sounds like his recommendations go further than pulling out all the stops from a political angle. Here's what he had to say.
We are actually recommending that people follow the CDC guidance, which lays out some clear guidance around if you're indoors, you should wear a mask and you should practice some physically distancing while you're indoors as well. But the main tool we have is vaccination. We didn't have that last time, and that's where the bulk of our focus is at this point in time.
And that really is the big difference between now and November of 2020 is we do have the vaccine now, but as we showed you in the graphic a minute ago, despite a vaccine, we have doubled the ICU capacity, or excuse me, population, compared to a time that was considered very dangerous and scary from Idaho healthcare providers. So the question being, did we really pull out all the stops today? To answer that, there could be more done. That's the truth. The governor could go further and do more. He has the option to do that. He stopped short of doing that, but we heard from the Director of Health and Welfare for the state of Idaho. They're recommending steps further, including masking inside. The governor has the power to take action to do things beyond what's going on today, but we'll leave it at that.
So the other number to pay attention to, those numbers back in November 2020 in the ICU, people were much older in that age range. The vaccine came out starting with the older people, dropping it down. The number that they're seeing in the ICUs now, down into around the 40s. The average age of people in Idaho hospitals and ICUs in the 40s right now.
And real quickly, just this afternoon, Brian, the Department of Health and Welfare said that they are seeing an increase of people being admitted to the hospital, younger people, those that can't be vaccinated, age 5 to 12. So something we're keeping an eye on.
All right, thank you very much, Joe.